Good morning, good afternoon, and for some, good evening. My name is Roels. I am a PhD student at the Institute for Family and Sexuality Studies at the University of Leuven, and I'm going to talk about couple communication during sexual and non-sexual discussions and how it is associated with relationship satisfaction. I'd like to start with a quote from Raymond Carver's short story, What We Talk About When We Talk About Love. It ought to make us feel ashamed when we talk like we know what we're talking about when we talk about love. The entire action of the story takes place over the course of an evening during which two married couples sit around the kitchen table, drinking gin, and discussing the topic of real love. The dynamics between the two couples are contrasted through their gestures and interactions with one another. Couple communication is a central theme to Carver's story and is described through their physical gestures, their silences, and most of all, with the words that remain unspoken. This to me is an interesting vantage point to start this presentation. Multiple studies found that how couples discuss conflicts in their relationship is a reliable predictor of relationship satisfaction and stability. In other words, the way that partners communicate about their conflicts predicts how happy they are with their relationship. Unsurprisingly, more negative communication, such as contempt, is related with less relationship satisfaction. Couple communication can be assessed using self-report, and this method can offer interesting insights in how partners experience communication in their relationship. Another way to assess communication between romantic partners involves videotaping couples as they discuss problem areas in their relationship and then coding these recorded interactions for theoretically relevant themes such as positive and negative affective expressions. Several advantages can be named of observational studies, such as the ability to capture live, real-time couple interactions and allow for objective coding of these interactions. This coding does not rely on participants' perceptions, introspection, or self-awareness, which can be colored by individual traits, such as attachment style, known to be associated with hypervigilance in relationships, resulting in over-reporting of communication problems. Observational coding can also compensate for unawareness of the subjects of changes in their behavior or differences in communication depending on topic. In a sense, observational coding also resembles clinical practice, as the observation of couple interactions is an important aspect of the evaluation of both more constructive and destructive communication patterns in sex and relationship therapy. However, up to now, little attention has been made to discussion topic. This brings us to the gap in the literature. Though relationship research has a rich history in the observational study of couple communication, the topic of sexuality was often not included in their study. In the study of the relevance of sexual communication, research is often based on questionnaires or self-reports. To date, only 2 studies have examined sexual and non-sexual communication using observational measures. In 2011, Rehman and others, including Eric Janssen and Julia Heyman, examined communication patterns during sexual as compared to non-sexual couple discussions in a pilot study of 15 couples. They found that especially negative expressions and behaviors during sexual discussions were sensitive markers of relationship dissatisfaction. In 2017, Rehman and others examined the observed differences between sexual and non-sexual communication in 115 couples and found higher levels of anxiety before sexual as compared to non-sexual conflict discussions. In addition, partners displayed greater warmth during the sexual discussions. These interesting findings point at important differences in how sexual versus non-sexual conflict discussions are experienced and navigated by romantic partners. However, research remains limited in this field, and no study to date explored observed differences in sexual and non-sexual communication and their association with relationship satisfaction. Enter our study, of which the aim was twofold. Our first aim was to compare communication behaviors during sexual and non-sexual conflict discussions, and our second aim was to examine the associations with relationship satisfaction. Based on the limited literature and prior research, we tentatively hypothesized to observe more positive and less negative behaviors during sexual compared to non-sexual discussions, and we expected positive behaviors during both discussions to be associated with higher relationship satisfaction and negative behaviors during sexual discussion in particular to be associated with lower relationship satisfaction. Our sample consisted of 126 couples. Because the current study focused on early relationships, participants had to meet the following inclusion criteria in order to be eligible to participate. They had to be between ages 18 to 30 years, to be in a committed heterosexual relationship for at most 3 years, and cohabitating. The methodology of this study consisted of questionnaires including demographics and sexual history, the Areas of Change questionnaire, couple satisfaction index, and observational measures, which we will discuss later. We conducted a series of hierarchically structured multi-level mixed model analyses with individuals nested within couples. This approach enabled us to account for the interdependence of couple data. We tested our hypotheses using the actor-partner interdependence model, which provides estimates for actor effects as well as partner effects. Actor effects are the effect of partner A's predictor variable on partner A's outcome variable, and partner effects are the effects of partner A's predictor variable on partner B's outcome variable. This study is part of my PhD project focusing on a wide range of affective and behavioral characteristics of sexuality and their relevance to relationship quality. I have already presented posters at prior IASR conferences, and if you have any questions about this, don't hesitate to ask me after this talk. Topic selection for this study was based on both partners' individual responses to the Areas of Change questionnaire, which they completed in separate rooms. The discussions then took place in the newly established laboratory at the Institute for Family and Sexuality Studies, pictured here. The couples discussed the sexual and non-sexual topic for 7 minutes each, in counterbalanced order, and these interactions were videotaped. To analyze these recordings, we developed a new coding protocol based in part on the specific effect coding system and the system for coding interactions and family functioning. 5 observers underwent approximately 8 hours of training, and we started coding our own sample once we achieved great inter-rater reliability on our codes for observational data from prior research. Afterwards, observations of our own sample were coded 126 diets, meaning 252 individuals, times 2 discussions, equals 504 videos. This took approximately 30 minutes per video. On top of their assigned interactions, the 5 coders were also assigned to code the same 56 videos to calculate inter-rater reliability. Only codes for which the resulting inter-rater reliability was in the good or excellent range were included in the final analyses. Next, we performed a factor analysis which revealed 3 factors. The first factor represents negative behaviors, included level of conflict, contemptuous behaviors, domineering and belligerence, and annoyance and frustration. The second factor represents affectionate behaviors, including lightness, collaboration, and affection. The third factor represents validating behaviors, including understanding and validation, and interest in and seeking out partners' perspective. Now, what did we see in our sample? Mixed model ANOVAs reveal significant main effects of discussion topic for all 3 communication behaviors. On average, more negative behaviors were displayed during non-sexual discussions than during sexual discussions. Compared to non-sexual discussions, sexual discussions were characterized by higher levels of both affectionate and validating behaviors. In addition, a significant main effect for gender was found for negative behaviors. On average, women displayed more negative behaviors than men during the 2 discussions. No other significant main or interaction effects were found. For the non-sexual discussions, negative behaviors were significantly associated with lower relationship satisfaction in oneself and in the partner. No gender effects were found. During sexual discussions, we saw that men who engaged in greater negative communication when discussing sexual conflicts were more likely to report lower relationship satisfaction, but this was not the case in women. The opposite was found for partner effects, which were only significant for women, indicating that women whose partner expressed more negative behaviors during the sexual discussion were less satisfied in their relationship. Looking at affectionate behaviors during the non-sexual discussion, we saw no significant actor effects. However, we did find significant partner effects, indicating that greater displays of affection by one's partner were associated with higher own relationship satisfaction. For the sexual discussion, the analysis revealed significant actor and partner effects, indicating that participants who displayed greater affection during sexual discussions were more satisfied themselves and also had more satisfied partners. We found no gender effects for affectionate behaviors. Looking at validating behaviors, we did not find significant actor effects. However, we did find significant partner effects, indicating that partners of participants who displayed higher levels of validating behaviors during sexual and non-sexual discussions were more relationally satisfied. Again, no gender effects were found for validating behaviors. Generally, we can conclude based on our findings that there are unique qualities to observe sexual and non-sexual couple communication, which are associated with relationship satisfaction in different ways for women and men. Our findings suggest that romantic partners soften their communication when discussing sexual conflicts specifically. Further, the pattern of gender differences in the association between negative behaviors and relationship satisfaction when discussing sexual conflicts suggests that the sexual domain may have greater relevance for men's relationship satisfaction. As a resident in psychiatry trained in medicine, I feel like my educational course was stripped from a proper introduction to the importance of sexuality in physical and mental health. This resulted in me being very insecure and uncertain about how to communicate about sexuality with my patients. I believe this sparked my interest in sexual communication, which led to the study of its importance in romantic relationships. A better comprehension of the distinct qualities of sexual communication may help both healthcare professionals and clients overcome personal barriers or feelings of discomfort that are common when it comes to sexual communication. This communication can provide a window to relationship functioning, grasping a glimpse of a bigger picture. Much like seeing specific branches of a bigger tree can tell us something about its health, even if there is much more to the tree that we can see. As I mentioned earlier, this is part of a larger project, and in the future, we'd like to explore more, including longitudinal and psychophysiological data and more diverse samples. Thank you for your attention.